So here we go. So we are recording. I think everyone heard that. So sorry for the interruption. Let me go back to what we're doing. Um, all right. Thank you guys. From the county, um, Zach or Amy, whoever would like to, could you introduce who's here from your team tonight?
Yes. Oh, where am I? There I am, and my colleague Amy Perkins just logged in. So if you could make her a co-host so she can unmute as well, that would be great. And while you're doing that, I'll just introduce myself. My name is Zachary Geidzik. I am Supervisor Horvath's Coastal and Mountains Field Deputy, covering the city of Santa Monica. And I also happen to have grown up in the city of Santa Monica, going to Will Rogers, John Adams, Santa Monica High School, and Santa Monica College. And I currently live in Ocean Park neighborhood, and I previously sat on the Ocean Park Association Board of Directors for about 8 years. So I'm the local boy. And with that, I think I will let Amy
Mhm.
introduce herself.
Thanks, Zach. Hi, good evening. I'm Amy Perkins. I work for the supervisor on housing and homelessness, and I'm very excited to be here tonight. Thanks for having us, Matt.
Yeah, appreciate you guys being here. I think I also saw, and I just crowned her a co-host, Dr. Funk. Is that true?
Yes. Hi, everyone. Maria Funk, LA County Department of Mental Health. I'm the Deputy Director over our Housing and Job Development Division.
All right. Okay. And then last but not least, from the city, Oliver, do you want to introduce who's here from your team?
Hey Matt, I'll just chime in real quick. Brian Hurley, Medical Director of Substance Abuse Prevention Control for the County Department of Public Health. Just rounding out the county team. It's good to see you.
Oh, thank you, Brian. Sorry, I missed you on there.
You're good.
All right, and now to the city.
Thanks, Matt. I appreciate it. Maybe is it possible maybe start with Lana
Oh
as the
yeah,
mayor?
please, Lana, do you want? I think you probably don't need an introduction, but if you'd like
Yeah,
to just
I
say
don't
hello
know.
to everybody.
Sorry. Hopefully you guys, I don't know, it's dark right now. I'm just lit the Christmas tree at the promenade. So I'm heading back into my place. And I will be bright and you can see me, but I'm the mayor, Lana Negretti.
Thank you,
Thanks,
Mayor
Lana.
Negrete.
Matt, my name is Oliver. I'm the city manager. Excited to be here with NOMA again. We have a couple members from the city team. We're looking forward to engaging with everyone this evening. Maybe Jing, do you want to go next?
Sure. Good evening, everyone. I'm Jing Yo. I'm the Director of Community Development. I oversee city planning, building and safety, and code enforcement.
Great. And then we also have Allison Crosby and Natalie from our Housing and Human Services team. Natalie, Allison, do you want to say hello?
Good evening, everyone. My name is Allison Crosby. Happy to be here with you all. I serve as the manager of our homeless prevention and intervention work with the city.
All right, great. It's glad to have you all here.
My name's, oh, sorry.
Oh yeah, go ahead.
Good evening. My name is Natalie Verlinich. I'm currently the acting director for Housing and Human Services, and I'm also the housing manager of the housing division.
All right, great. I think that rounds it out. Thank you all for being here. It's great to have so many folks from the state, the county, and the city all here. I just want to acknowledge the NOMA board. Thank you for everything that everyone does and for helping to prepare the meeting, especially Bruce, our chair. I just want to briefly introduce myself for those who don't know me in the community. I'm hosting tonight's meeting. I'm Matt Goldenberg. I'm the vice chair of NOMA. I also am a local kid. I attended Roosevelt Lincoln Samo. I'm the father of two daughters we're raising here in Santa Monica, and they go to the schools here in the city. They are the reason why I got involved because I really wanted to help bring back safety, bring back cleanliness to the city. I grew up here, and I'd like it to be a place where my kids could enjoy the same kind of things that I did. I'm also a board member of SMPA, our patrol organization that's north of Montana. So if you're not a member, I will plug. You should join. We have three ongoing patrols at all time, and otherwise I have no conflicts of interest to report. I want to just kind of set some ground rules. This is kind of part two to the meeting that we had back in October. And we're trying to tweak things a little bit so that we can have more communication and I think a smoother ride through the meeting. So if you haven't already become a member of NOMA, you can sign up through the website. You can get the meetings in advance, the meeting notices in advance. That's particularly pertinent to tonight because we did solicit questions to be given in advance, so that we could try to make sure that we stay on topic and we make sure those who are asking questions and answering questions don't get interrupted. There's going to be future meetings on Bergamot, on the Civic Auditorium, the Great Park, emergency planning, and I know Bruce is planning in the new year to maybe invite some, if you're all willing to come back from the state, the county, and the city to really dive deeper into some of these issues. We may not be able to cover everything, or we won't cover everything tonight. So there'll be other meetings on other topics and even maybe digging deeper into the topics we talk about tonight. But we're really going to try to focus on what's happening on Ocean in this meeting. Unmuting was disabled, if you haven't figured that out, because last time things went awry. So we're really trying to keep it to giving our presenters, as well as the questions being asked, the airtime that they need. You're welcome to put questions in the chat. And time permitting, no more board members are going to go through the chat and try to identify questions to get a lot of thumbs up. So I just want to remind everyone, and I'm trying to admit people as they trickle in. So if you're waiting in the waiting room, I apologize. We had posted objectives. We were going to focus on these three things. What was it? And I'll just back up for a second for those who weren't at the last meeting. In October, we had a meeting where it was shortly after the county program on Ocean Avenue had been announced. There was a lot of community pushback. And after that meeting in October, I don't remember the date, those programs were canceled. And so the goal initially for tonight's meeting was to talk about, well, what's going to go on going forward, both on Ocean Avenue and in Santa Monica and around the county with similar programs. Then there was a little bit of a change, which we're going to talk about in just a second. So to start off, our original topics were going to be what's going to happen on Ocean Avenue now that the projects are not moving forward. Are they moving forward elsewhere in Santa Monica? What lessons did we learn from the process and how can they inform us in the future? And how will the state, county, and city, who I'm grateful to be here tonight, will communicate and work together going forward on future Santa Monica projects in alignment with the city's adopted Council Item 16F. So that's what we originally wanted to talk about. I want to just set the stage before we start the discussion that NOMA sees this as a community problem that can impact every neighborhood in Santa Monica. It's not something that only affects NOMA. We want to talk about solutions that would help the entire city of Santa Monica and every neighborhood. And NOMA supports long-term ethical and evidence-based solutions to address housing and mental health and addiction treatment programs for vulnerable populations. So that's really the lens in which we're hoping to have a conversation. So we can't, unfortunately, talk about the long-term stuff that we were hoping to, because over the Thanksgiving holiday, there were some new non-county programs that came in on Ocean Avenue, as many of you know. And so that's kind of changed the agenda and the order of what we're going to discuss at this meeting, because there's now stuff happening in real time on Ocean. And I'm going to turn things over at this point to Oliver and his team to hopefully kind of give us a high-level update of what's going on at Ocean maybe over the last week that everyone's been concerned about, and what steps has the city taken and what's going on the city level to address the concerns that have been raised by neighbors about what's happening now. So if that's all right, Oliver, I'll turn things over to you.
Oh, thank you so much, Matt. Appreciate the chance to share a little bit about the circumstances that sort of took over last week. So as folks here probably know, last week on Wednesday, the city, we were notified that there was something happening at 413 Ocean Avenue. Appeared there were folks taking residence in the building, was the report that we received. Our team in community development includes our code enforcement team, the building and safety team, also our fire department, life safety team, and the administration really jumped into action that Wednesday. We went out, contacted the current, there's the property owner has a developer that's working on the project. We contacted the developer to get a sense, was he aware of anything that was happening? And we also dispatched folks out to 413 Ocean. What we found was that there were folks living there, it appeared. And as we dug into the situation, an unpermitted residential sober living operation had sprung up and started functioning that Wednesday, November 26th. On that day, we identified there were about 30 people that had moved into the property. There were no permits issued. There were no approvals. There was no life safety reviews. It was not permitted. And so as we started assessing what do we do, the team worked throughout the day, and around 8:30 or so that evening on the 26th, we went ahead and issued a couple of different orders. One, in order to vacate the building, given identified life safety issues, because it was in a habitable location that triggered habitability issues, and a relocation order was also issued requiring the operator, property owner to relocate folks that were living in the facility. We also issued an administrative citation and a notice of violation given all of the code related issues that we observed. We directed the operator to immediately relocate everybody, give them 24 hours to comply, and that rolled then into Thursday, Thanksgiving, where we followed up as a city and coordinated to have an inspection of the facility on Friday, November 28th. On the 28th, we did do a full inspection. We learned that the sober living operator was initially planning to move 58 individuals into 413 Ocean. As we assessed the property, the inspection process really identified that all of the issues we thought were problems, there really did exist problems at the building. We verified then at that point with the operator that they would comply with our notice to vacate. As we worked through the issue the next couple of days, ultimately what we were able to identify, the unpermitted use, the operator, they indicated they would not be operating at the location moving ahead. The operator told us they're withdrawing their business license application and that they would not be coming back to functionally run a sober living facility at 413 Ocean Avenue. This week on December 2nd, we did a follow-up inspection. We have confirmed the building is vacant. So at this point, what we're doing with regard to 413 Ocean, really there's a regulatory follow-up process. There's code compliance stuff that has to happen. And if there's going to be any future use at the site, we're certainly communicating with the property owner and the developer what those requirements would be if they want to move forward doing something at this point in time at 413 Ocean. That's a quick summary of what happened. I'm going to ask the rest of the city team any other components maybe that we missed that might be important to share at this point. Jing or Lana.
Yeah, I think I would just add that at this point, the city does have an active, a live plan check for 413 Ocean Avenue. That was a result of the prior transitional housing proposal. So there is a building permit and the scope is for a change of use from the former, it was a senior care facility into transitional housing. So under the building code, when you have that change of use, you have to get a permit for that. And our inspectors also found, that there was evidence of unpermitted work, whether it was done by the current operators or developer or prior owners. It doesn't matter in the city's eyes if, something doesn't have permits. Whoever the current owner is becomes responsible for that. So the scope of the permit is meant to legalize that unpermitted work, which includes, quite a bit of electrical work and things like that, which is what led to the habitability determination and the order to vacate. So just wanted everyone to be aware of that is a building plan check, permit that is in process right now.
I don't, I'll let you guys go on. I think everyone wants to hear like what's going to happen next. So I'll let you guys continue.
And then I have some questions as well, but Oliver, did you have any additional follow-up on that or?
Yeah, no, I think the only thing I'd add, Matt and I did have a chance to chat before this discussion. So I know certainly the issue, it's prompted a lot of concern. So we're hoping we can have a discussion over what happened, answer questions, address the comment Lana made, which we think is important, what's going to happen next, and identify some of the things that we've been doing, thinking about the differentiation between sober living facilities versus behavioral health facilities, and try to get to answering the question that Matt posed at the beginning of this discussion. As a concern for the overall systems in Santa Monica. How are we thinking about these projects moving ahead? What are the regulatory approvals that the city has? All of those components we're happy to engage and discuss.
That'd be great. I think that's what I think would be a helpful place to start the discussion. So back to my slides. And Oliver, I think you touched on basically all the things I have on this slide. So what I was hoping to do is maybe spend somewhere around like 5-10 minutes here. Again, kind of higher level stuff, whatever you all feel like is most important. And then the reason why I think it's so essential to have the county and the state here is because there is so much overlap between what's happening and understanding. And one of the questions is, what is the difference between a transitional housing that the county may be running and this sober living that's run by a private entity? But there's also state law that comes into place. And so that's where I'm going to bring in after we talk, have you guys lead the discussion from the city side, bring in the county and the state to really start focusing on how does the county and is involved in things like this, and how is the state even involved in these kinds of things? Vulnerable populations who are seeking housing and are put into a place over a holiday weekend and now are unhoused again, or potentially, or brought in from other states because they're utilizing commercial insurance. So I think with starting from the city side, Oliver, I think you kind of touched on these being the hot topics. Do you want to, in any order, touch on the things that you said? And I think these are the main questions that came in from the community that seem to be most urgent for the city.
Yeah, certainly, Matt. Maybe Jing and I can tag team this conversation. But the last couple of, the last month or two at 413 Ocean, also 825 Ocean, maybe it helps to start with what we understand to be the ownership model and how these projects are getting sort of proposed. There's an owner of the property that currently resides in Florida. They have a developer who's been trying to figure out a way to utilize the properties in question. As we've experienced the last couple months, there have been a couple of different uses proposed. The most recent use that wasn't just proposed, it was actually implemented in an unpermitted way. I think the first thing I'd note is the laws, codes, permitting systems we have, they worked as it relates to reacting to something that wasn't allowed, right? If you think about it, on a Wednesday before Thanksgiving, 30 to 58 people moved into a facility in an unpermitted manner. We were able to quickly respond and within a couple of days, really resolve the issue and shut the operation down. The sober living home situation, though, that operates, it's a different type of operation compared with transitional or supportive housing, compared with a licensed facility that might be operating. And what Jing and I thought might be helpful is talk a little bit about what things are different, but talk through also how, from a relatively speaking, the city, the question that I see here is what codes and laws does the city have to prevent this and similar projects in the city, to really describe some of the limitations that the city has. We can enforce building codes, we can enforce code requirements for buildings, we can enforce life safety issues for sure. You need to get permits, obviously, before you operate. But from a planning perspective, if a facility is identified as housing, a residential housing type, there are restrictions and requirements that the city has to abide by, where the city has to allow for a lot of these uses. We don't have the right to reject these uses in most instances. So in answering the first question, I think there are some limitations, and maybe Jing, would it be possible to run through some of that in a little bit more detail for everyone tonight?
Sure. So I think, when we see proposals like this, I think one thing is to probably easier to think about, where does an area that the city does not have discretion over? And so when we're dealing with sober living homes, where there are 6 beds or less, and that these homes exist throughout the city. We see them come through, we get notified sometimes, they come in single family neighborhoods, and those are enshrined in state law. There are very strong protections there, and And this is across the state of California, where there are 6 beds or less. A city cannot prohibit that at all. That is just considered like any other residential use in the city. So that is something to understand. The other piece is another kind of housing, that the city, again, has no discretion over is transitional and supportive housing. And that kind of housing is defined in state law. Essentially, there are kind of like two qualities, and I'm sort of generalizing it, but for example, for supportive housing, there's no limit on length of stay. It is occupied by the target population that's defined in state law. It has to be linked to on-site or off-site services that assist that resident in maintaining that housing, improving their status, and maximizing their ability to live and work in the community. So if there is a proposal that meets that definition of supportive housing, the city must allow it. The other kind of housing, transitional housing, also is defined in state law, which is buildings configured as rental housing developments. But what's different there is that it's operated on a program that calls for the termination of the assistance and then circulation into another program at some future point in time, but it shall be no less than 6 months. So you can see there that like duration of stay is important. The services provided are important. So again, if there is a proposal that falls under that definition of transitional housing, the city has no discretion to say that's not allowed. That is to be considered. Supportive and transitional housing are not to be regulated differently than any other residential use in that same zone. So if it happens to be in a multifamily zone, you must treat it like a multifamily use. And I think moving out from transitional and supportive housing, so I've talked about the sort of like 6 beds or less, the transitional and supportive housing, the city must allow those. Now, when you get above 6 beds, so this is where, from a zoning perspective, we would ask kind of a series of questions. If someone proposes something, then we would kind of walk through, because then we're getting into other use classifications in the code. And it's like, okay, like just with any use in the city, we would try to understand, is this use allowed? And you kind of have to match it up to like the definitions and see, is it allowed in the zone? So just as an example, if there was a sober living home or once they were proposing that, and it usually comes in through a business license, right? And it gets sent to city planning and review it. So that's sort of the order, is like we get the land use review, and then we would go through, okay, it has more than 6 beds. So it doesn't necessarily mean that it's, sometimes you hear this term like group home or group housing, right? We would just have to, that term doesn't exist, in our zoning code. So it is a fact-specific assessment. It's very difficult to make a huge generalization about like, well, that is this or that is this. That's why we go through these questions. So we would want to understand, uh, does the facility require a license from the state, from Department of Social Services or Department of Healthcare Services? That's an important sort of like threshold to figure out like what kind of use it is in the code. We want to understand, what kinds of services are being provided, how are they being provided on site, just again to understand and sort of like ground truth, the licensing requirement. We would want to ask, are you linked, to programs and services? Are the clients and they're linked to that? So we would, understand that. What's the duration of stay? And then who is the population that is being served? So it's just like, it just gives us like that full picture to understand, because if it is needed to be licensed, then it falls into a category called residential care facility, right? And those are facilities that are licensed by the state of California. And what's different there is they provide drug and alcohol treatment. So for example, detox, group counseling sessions, individual counseling, educational, drug abuse recovery or treatment. Those kinds of services are licensable under the state of California. So a sober living home that provides those services, must be licensed. However, if they don't, right, and they say, I don't need a license, then really what it is, it's kind of like it's a group of people living together, in a structured, like peer supported environment, that's essentially, helping them, get stable, right, and sort of integrate back into the community. So it's meant to provide people who've just come out of that, detox rehab process. They need a place to live, that is structured and supportive for those in recovery. So that's kind of a distinction. That's why we would ask those questions to figure out and ground truth, because we have encountered these situations in the past where someone insists they don't need a license, and we're kind of like, "Are you sure?" And then we'll actually call the state, and just ask like, "Hey, this is what they're telling us. Does this sound right to you? What kind of paperwork have they filed with you?" We have sometimes found in the past that the state licensing department says, yes, they absolutely need a license, and by the way, here's some additional information. So it's the reason we ask those questions, but, I hope that's helpful in kind of understanding the process that we go through to kind of like how we assess these uses.
That's great, and I appreciate it. And I will come back, Mayor Negrete, and I want to make sure we have airtime for the 16 item, but I want to give time next to the county. But before I move on to the county, I don't know, Oliver, if you'd be the best person to ask. I'm getting questions populated to me from NOMA board members, and one of them is about are there going to be any legal consequences for the owner who attempted to skirt Santa Monica laws by moving occupants into an unpermitted building? What's going to keep him from trying this again? I mean, it sounds like there's a robust process to ask questions and make sure things are appropriate. But if somebody just skirts them, what do we do? Any sense of that?
For sure. So as part of the process, we did issue administrative citations, and every day that the operator was out of compliance, we're going to process the appropriate fine amounts. Jean, can you remind me what was the fine amounts? It was a fairly substantial amount that we're going to ultimately be charging, given the issues that the operator created.
Yeah, potentially it's up to, I believe it's like $2,000, per day for each occupant. Don't sort of quote me on that, but they are being, the fines are being issued under the notice of violation and the administrative citations, and the property owner is being invoiced for them.
Yep. So in terms of the violations, the couple of things that absolutely had to happen, they had to vacate. They moved people in illegally. We identified it wasn't safe. They didn't have permits. You have to relocate those folks. In Santa Monica, we have very robust habitability rules. And because it wasn't a habitable place that the operator moved people into, they had to pay for the relocation for folks to move into somewhere that was habitable. And then to Jing's point, the fine amounts, given the number of violations that we have, I do think it's 2,000 up to 2,000 per person per day. And so we tabulated how many people were in the building in each of the days and each of the inspections that we went to. That's the fine amount that we'll be issuing. We know there were about 30 people there on Wednesday. We know that at some point they maxed out at 58, and they finally moved everyone out. We confirmed it December 2nd. So you can back into the math. It'll be a fairly hefty fine that we're going to be issuing.
Okay, great. All right. Well, thank you for that. So I think I'll
Sorry,
can I? Oh, yes.
Sorry about that, Matt. Can I just ask Jing and the city manager what happens if they don't pay that fine?
Nice question.
We have a robust city attorney's office, and we will be filing to make sure that we're compensated. Ultimately, we'll initiate all legal proceedings. They're all approved. The fine schedule is approved via the city's municipal code, and we would enforce via the courts if they didn't comply.
All right. Thank you for all that. So staying tethered to what's happening on Ocean before we go macro and take a look around the city and the county. These are questions that came up from the community about what's relating to what's happening on Ocean. So one set of questions for the county, and I'll let you all decide. We're hoping to spend maybe 10 minutes on this part of the conversation. Who would like to answer? But one set of questions comes up about the developers. We just heard about a developer who tried to put or did put, Oliver, I think you said, was it 56, something like that, individuals into an unpermitted building skirting law. And the question is, are these types of developers the right partners for the county going forward when we have goals for housing and mental health and addiction treatment for vulnerable populations? For those who aren't making the connection, this was the same partner who was originally going to be involved in the transitional housing on Ocean that was canceled. He then chose to work with a private company to put in a sober living, and in doing so, I think we're hearing, I don't have to say allegedly, or it appears it's skirting the laws. So are these types of developers, this one specifically, going to be the right partners? How is this going to impact future projects with this developer specifically? What process is going to be established to vet partners that the county will engage with going forward? Is there going to be an auditing, sanctioning, termination of contracts with partners who don't follow protocols? And then, as far as the county goes, is there going to be any sort of change in policies or procedures to try to regulate these kinds of sober livings? And if not, if it's a state question, that would be good to know, because then we can just ask the state, are they going to change things? But we clearly see that there's something going on here in Santa Monica that's going rogue. And so I think that's a broad question of the county, is how can the county be involved in helping to rein this in? So if I could turn over to the county folks to give us
Yeah.
your thoughts on that, that'd be great.
Yeah, I'll start. And please, Dr. Hurley and Dr. Funk, step in if there's anything that I mislead or you have more to add. I mean, I think so important. We just want to start. Obviously, the projects that we were to procure at 413 and 418 are permanently terminated. So those projects will not be happening. In terms of property developers and property owners that we work with to bring people indoors who are formerly homeless, or experiencing homelessness in one of our shelters. We work with a lot of different people who own sites. We don't contract with those people to operate the sites. So there are buildings owned by people who are not the most, maybe not the most ideal property developer, that are willing to give us different sites that we have used all across the county. Again, there are all kinds of people in LA County who own what is a not nearly enough housing, certainly not housing that's affordable enough for us to utilize it for people who have been homeless. So we work with all kinds of developers, all kinds of property owners. They take our Section 8 vouchers, they take our housing subsidies. We contract them for different shelter beds, but then we do contracts and programming with community-based organizations that are vetted, that go through very long processes. We monitor them. We don't monitor the person who owns the site. We lease the site. We operate the site with the developer that we've chosen. And of course, we hold them to the standards, all of the different kinds of zoning and the different regulations about the permitting fall from the city. And so those will all be, of course, and there are times, depending on how the contract is written with the community-based organization, that maybe the developer plays a different role in terms of delivering on what has to happen at the site. But we have partners in the people who own these sites. I mean, they're a partner because they're giving us a location, but the program that we run there, we run through vetted community-based organizations that we recruit. In terms of moving forward with a project with the same developer, so we are assessing another project that he has, another property that's in Santa Monica. We have no idea if it's feasible at this point. So we're doing an assessment to see if it's even feasible. And then we'd have to bring that to what we understand is a process that's been agreed upon by the city council, and we would do that. I think it's really important to say the dollars that are allocated here are allocated to this SPA. So that's a service planning area. It's a term we use in the county to divide up the county of Los Angeles. So this is SPA 5. It includes the West Side. And these dollars that came from the state in a grant that's called Behavioral Health Bridge Housing, so we'll call it BHBH, those dollars that are still available are allocated to this SPA. And one thing that happened when these projects were identified and the conversations started happening about the properties on Ocean, we said, hey, Santa Monica said, we give a lot of, we're a very good partner and we provide space for services and programs to happen in Santa Monica. We would like the services that are provided to be provided to the people in Santa Monica. So we said, yes, okay, great. This BHBH site will be provided for people in Santa Monica. The same would be true if we identify another location that we then tee up for the city to decide if they want to move forward. If in fact the city of Santa Monica decides, no, we don't want to have this sort of supportive service, then we would go outside of Santa Monica. And the people who are experiencing homelessness with severe mental illness outside of Santa Monica would go in those beds. So I do also think it's really important that we say that We hear from lots of constituents in Santa Monica every day. So there is a wide range of opinion about what kind of services and support the constituents in Santa Monica would like to provide for people who are homeless on the streets of Santa Monica. People that we hear about every day in our office, people, many of whom who are constituents in Santa Monica that we know that we're helping, that we're supporting, that are getting support from our Department of Mental Health, that may be enrolled in SAPSI programs. So, I say all that just to say, yes, we are still moving forward to consider a site in Santa Monica. But if we were to come back and the constituency here said we're not doing a project with you here, then we would go outside of Santa Monica. And we're also doing feasibility assessments outside of Santa Monica for those dollars that we still have available.
Got it. So
Did
I
I get all
guess
the questions?
I think so. So I guess what my question would be, it sounds like you work with partners who operate the programs, but the
Hmm.
developers provide the sites.
Hmm.
Knowing that taxpayer dollars would trickle down to the developers who own the sites, is there anything a developer could do that would make them an um what's the right word, would make the take them off of your list? Like this developer is breaking law and is being fined by the city of Santa Monica. Is there
Yeah.
anything that this specific developer could do where you wouldn't work with him, or if there's a viable site that he could offer, there is no process now for discretion from the county to say no? Does that make sense?
We are in a position, Matt, unfortunately, when we're housing people who are homeless, as I think is evidenced here, we often take what we can get when it comes to properties, when it comes to sites. I used to be a person I did housing for people. You take them to apartments and units and shelters all over the county. We are happy when we get to site another location to bring someone inside. So yes, I am certain that there would be a past the point of no return with which we would not do business with a particular developer. Um, but we house people in all kinds
Yeah,
of places and run you know we see the stories. we
right.
we all are familiar with people who own property, and there are lots of allegations made. And certainly when something gets to a particular place, of we've certainly stopped working with all kinds of people, especially our directly operated community-based organizations, if there's suspicion of fraud. 1000%. But yeah.
Yeah, I think I'll just speak on behalf of the community with all the questions that came in. I think there's just a concern that whether it be ethics or legality, that there are certain developers that maybe shouldn't be partners, knowing that this developer took vulnerable people in early recovery who were seeking a sober living, put them into an uninhabitable, unsafe environment over a holiday weekend. I just think that the community's concerned that maybe there should be some criteria that's used to determine that maybe this developer going forward, even if they can offer housing, if it's not ethical, if it's not safe, if they're in multiple lawsuits with other jurisdictions, is this the right type of program, or can we do better? So I just, if anyone
I
disagrees
would
with
love
that
to do
statement, they can
better.
put it in the
We
chat. But
would
I
love
think
to
we would
have
like a
more.
process to know that there is sort of some vetting of the people that the county is going to work with, because I think that's in some ways one of the core issues that's going on here, both with
Yeah.
what happened originally at Ocean and what happened over the Thanksgiving weekend.
100%. I hear you. 100%. I wish we had the most above board people operating every shelter. And I have to separate, not operating, owning the land, owning the site for every bit of housing where we put people, where we're housing the over 70,000 people that are homeless in LA County. I wish, I wish that we could place them in every neighborhood, in every community that they want to call home, that they may have originated from, in every kind of apartment type. It's we do not we do not always have that option. We
Right.
do not always have that option. We have housed people all over the county. Do we move people? Do we stop working with vendors? Are there allegations that come out and we change course? 1,000%. Of course, 100%.
And so I guess I have just two quick questions. One is, it sounds like this developer does have other properties in Santa Monica, and so they are still being considered to be potentially used for the transitional housing that was canceled on Ocean. Is that accurate to say?
Yes, that's
Okay.
accurate to say. Yes.
And
And
the
Matt, I
oh yes,
just apologize. This is Zach from Supervisor Horvath's office. I also
Mhm.
just want to emphasize, I think, a really, really critical point, which is that we don't have like an abundance of options to look at for these things. It's not like the city of Santa Monica, oh, we have, like 100 sites that we can go through and really like judge realistically what is feasible, what makes sense, who are the owners, all these things. The harsh reality is that realistically there might be, and I'm not thinking of a specific one, there might be one or two in the entire city. There might be maybe four possible sites in the entire spot five. I mean, that's the amount of limitations we're under when we're looking at that. And it really, really makes it difficult when we need to site these housings because we have to bring people inside. We cannot leave people outside. We know that nobody wants to see that, and that is just the worst thing. So it really does limit us and makes it very difficult when we're looking at these situations to try to find these opportunities. And
Sure.
so that's the limitations that we're working under. I have seen sites looked at that were just so absolutely ridiculous that the moment we actually analyze it, it's like, obviously that wouldn't work. But we have to keep looking. We have to keep trying to
Right.
identify situations because we know that apathy is the enemy here. We have to keep trying and we have to keep fighting and trying to identify more locations because we need to get people inside.
Got it. And then just for clarity, I've seen it a couple times in the chat. Was it just said, Dr. Perkins, that the city of Santa Monica did agree to these bridge housing facilities on oceans? Because I heard you earlier in your statement saying that the local jurisdiction has to agree to these kinds of things or you'll look elsewhere. And I think you followed up by saying that Santa Monica did agree. Did we hear that correctly?
No, first, I'm not a doctor, so I want to make very
Oh,
clear. I don't
okay.
want to
Sorry.
present myself that way. I'm a social worker.
I'm one with the
Secondly,
chat.
uh, what we said was we will not put another BHBH project in the city of Santa Monica unless the city of Santa Monica agrees.
Okay.
So
Got it.
what we terminated the project before because there were neighbors in Santa Monica who said we did not know about this. The process was not transparent. The supervisor said, I hear you, and the projects are terminated.
Got it. And just because I'm naive to this whole process, when you say the city has to agree, would that be a vote of city council? Would that be Oliver
No.
saying yay or nay? Would it be the city staff? What is that process where Santa Monica would communicate to you yay or nay?
My understanding is that the city council proposed a process. They had an item that they had on their
Okay.
agenda and
So
that you
we'll
have
go
to go
through
through
that
those
process.
steps.
Okay,
Yes.
gotcha. All right, great.
Mhm.
I know we're short on time, and I'm going to just move to give the state an opportunity to chime in unless there are any final thoughts on this topic from the county, and I'll bring you guys back in shortly. All right. Okay, for the state, I think one of the big topics that has come up has been the funding. And, this idea of we don't have enough beds, we need to bring people indoors, but these are vulnerable people. Initially, they were unhoused individuals that were looking at bridge housing on Ocean. Then it became a sober living, for a private company that was for folks in early recovery who have been caught in the middle of this. And I hold myself out as being someone who's really naive to state policy and state laws, but people have brought up and the questions they asked were about how does this impact fair housing laws? I think we heard in the statements from the city about if there's a housing designation, the city must allow sober livings 6 beds or less. City has no jurisdiction. If it's transitional or supportive housing, must allow. If it's a residential care facility, then there's some leeway for what licensure would allow. So I guess what my questions are, if you could help explain to all of us is this involving fair housing legislation laws? I think I'm describing those. Is that what we were intended to accomplish? What laws and regulations and permitting process from the state level is needed to be changed to help vulnerable people from these kind of unethical sober livings and transitional housing projects? We just heard there's a lot of unscrupulous folks that counties are trying to deal with. Is there an opportunity for state law to be amended or changed? And, these are vulnerable people in Santa Monica, all across our neighborhoods. Do you have any suggestions, ideas? Is there legislations being proposed to address what you just heard is happening in the county and the city? I'm kind of turning to you all as experts at the state level. What is going on at the state and how can the state potentially change things to be helpful? I know
Yeah.
those are broad strokes, but I'll turn it over to you.
Yes, absolutely. So yes, there was state funding in the original project, and our office is of the mindset that we do want to bring state dollars to our district. We want to make sure that there are resources for interim, transitional, permanent housing all across our district because we know there is a great need, especially in SPA 5. When it comes to substance use treatment centers, especially something like this, there is a very, very complex web of licensure. And as you mentioned, there are some that don't require license if it's a under 6 people in a home. It depends on the type of treatment there is. And to be very, very transparent, they're licensed by different entities, everything from Department of Health Services, California Health Services, and Department of Social Services. And those depend on what type of program it is. Now, our office has been concerned about the regulation of these types of programs for a long time. We actually introduced a bill 2 years ago called SB 1339, which aimed to regulate these types of unlicensed facilities. And it was meant to try and update these regulations to require any entity to verify their license or certification of residential care facilities and inform patients of their license or certification. It also improves accountability within the mental health care system and directs Department of Healthcare Services to create a voluntary certification program for facilities that are not currently licensed, like that don't require the full licensure, so that it sets minimum standards and create a system. Unfortunately, that bill did not pass, but it is something that we are looking at and ways that we can continue to improve this area. So it's an area our office continues to work on and try and pass, regulations for these unlicensed and frankly fraudulent, substance use, or they say they're substance use facilities. So that's something that our office is continuing to monitor and work on in the state legislature.
Got it. Appreciate that. I think that it sounds like there's work being done. It sounds like would you say it's been identified at the state level? I mean, it sounds like it has. What do you think would be holding back getting consensus on something like that? You would think that would and I was trying to follow the thread. You said that it was proposed. Where does that legislation stand that you mentioned had been proposed?
So it did not. It ended up dying in committee, and that's mostly because it was the politics of the time. It was attached. It got conflated with another bill. So that was just the reality of the time. So it's kind of the nature of state legislative politics. But something that I think is a big barrier is that enforcement means money, right? To enforce these types of to have someone go in and inspect and do that requires money. So that is a barrier to passing these laws, but it's not something that we are necessarily. It's not that we're not going to do it, but that is an ongoing barrier that has prevented things like this from happening. That's just the reality of that.
And any thoughts? I mean, because it makes sense about enforcement with the funding, but one of the broad questions that came in, multiple people asked about kind of outcomes. People talked about the New York Times article talking about that there's developers, the same one who owns the property on Ocean Ave is going to circumvent policies and procedures, find loopholes. Are there proposed, because we know the dollars coming from the state, so people wanted to understand, is there any sort of oversight looking at outcomes of where these dollars end up, auditing the outcomes of the programs, on the state level? Is there anything that can improve the downstream outcomes and decrease the abuses and the loss of all of the funding that's been widely reported? Any sense of where that stands?
Yes, sorry, let me pull up my notes so I can make sure I'm providing the correct oversight. So this year, we did pass laws that would strengthen oversight over particularly local homeless services and local homeless shelters by requiring annual inspections by cities and counties, whether or not complaints are received, and provide stronger enforcement by allowing civil actions by both individuals and the Department of Housing and Community Development. And it also requires annual reporting from all jurisdictions and authorizes the state to withhold funding from cities and counties that fail to comply. So that is something that has happened this year.
One question that came in was around, and I think it's the CEQA numbers, the amount of housing that's going to be required from every area, every city. Do you know, and I'll throw it out to anyone who can answer from any of the panels, are these transitional housing, supportive housing, sober living housing, does that count towards these numbers that the state requires, or are these not included in those numbers? Does anyone know the answer to that?
So I can answer that. So
Hmm.
if it results in the creation of dwelling units, and dwelling units is a defined term, right? It's a unit that has sleeping, cooking, and bathing facilities, so sort of bedroom, bathroom, kitchen. If it results in that kind of like one dwelling unit, then yes, that does count towards the arena. With sober living, it tends to be more of a kind of like a group housing situation, where you might have the bedroom, a private bathroom, but a shared kitchen. So in that case, that's not considered a dwelling unit.
Got it.
So that would not count towards the arena.
I appreciate it. And I misspoke, but I think you got me. It's supposed to be RENA numbers was the acronym I was supposed to use. One last question on the state level. A lot of people asked, why are state, and I'm just kind of paraphrasing what the questions were, but why is the state using taxpayer dollars to fund a lot of short-term types of programs in expensive, densely populated neighborhoods like Santa Monica, instead of looking for larger, more affordable properties or repurposing older government properties like Metro State Hospital in Norwalk? I don't know if that's true or not, but that somebody gave that example, to develop longer term solutions with higher levels of service to house more mental health and addiction treatment. The general consensus is people feel like the developers are really benefiting from these shorter term solutions, but the unhoused populations, our communities, and the residents are not. Is that something that you could speak to from the state level? Or is there a longer term solution being worked out and proposed? And it seems like it falls on the counties and the cities, but from the state level, is there anything
I
going on?
think from the state level, there is an emphasis to build more housing everywhere, not just and more affordable housing, more permanent supportive housing, and long-term options to address homelessness in that way. And I think it's not just, for Santa Monica, it is for across the state.
Got it. Okay.
And I just also want to comment, Matt, on
Huh?
the unused, government buildings part of it, to just sort of in a general sense. And this has been happening since I first joined the county, a little over 8 years ago. But every single parcel of government-owned land, whether it's owned by the city, the county, the state, or the federal government, has either been studied or is being studied or has been decided that it is feasible for housing and housing has been built on it, or housing is being built on it, or housing is being entitled to be built on it. Because we know this is a crisis. And so that was the very first place that we all sort of went to first when it came to trying to identify places where we could build housing, whether it's transitional short-term housing or longer-term supportive housing or just affordable housing in general. And there are a lot of programs that are currently underway. For instance, there's Metro is currently looking at all of their own property and has an entire program that I really should be more familiar with, and I apologize I'm not, that tries to maximize the amount of affordable housing that we can build on those sites in partnership with Metro for that government-owned land. But I think it's always important to remember that there are not, vast unused government lands with a whole bunch of surplus unused land or buildings that could be used, very easily that no one's considered. All of them have been looked at for the most part. If there is one that you know of, please let me know because I'm happy to look at a new one. Always happy to look at additional sites and see, is this feasible? It might be, it might not be, but we're always happy to look at additional sites and identify those types of things. But I think it's just important to understand that that was the first place that every level of government looked for when it was really understood just how severe this crisis was getting. So just want to make sure that's clear.
Okay. Well, I will task everyone here to email or put into the chat land they can suggest to Zach that we could use. Before I turn back to the county, I want to just ask one follow-up question for Sophia. Will Senator Allen commit, I'm putting you on the spot, to introducing or reintroducing a bill this year to ensure that we aren't funding bad actors like this in the future, or introducing a bill this year to make the situation better from a state level? Or could you commit to bringing it to him and asking him if he could consider such a thing?
We are currently looking at different options that could tackle these types of, fraudulent and abuse that are happening in this space. So that is something we are actively looking at. I can't commit to anything. That is the senator's job to make
I
those
understand.
commitments. But I can say that we are, actively researching about possible solutions. And we welcome any of our partners if they have possible bill ideas or ways to tackle this. We're happy to partner with them on that as well.
Okay, great. I appreciate that. I'm hoping maybe you guys will get some ideas from the rest of our discussion and pass it on to Senator Allen. I'm going to turn back to the county and try to take a step back now from just what happened over Thanksgiving weekend. It sounds like, I feel better hearing what the city's been doing and following up. And actually, let me ask one clarification because it came in and now it's applicable, and then we'll go to the county. Oliver, you had mentioned, I think, and a couple of people were texting me asking that the operator is not going to move forward with 413 and 825. Did people hear that correctly? Did you say that the operator is not going to move forward with sober livings at that site?
Correct. The sober living operator that we were dealing with, they seem to be operating under a couple of different LLCs, but they all had the same individuals working at each of those LLCs. The individual represented themselves as their corporate counsel. They verified with us that they are withdrawing their business license application, that they won't be pursuing a sober living operation at either of the addresses. They apparently were considering both. That's the operator, though.
Right. The question is about the developer. Do you have any sense of what the developer is planning to do?
I guess the best way to describe that, we have reached out to the developer and the property owner. We're trying to engage discussions to understand what's going to happen next and identify, really how do we try to not recreate these types of situations again. If there is, some type of use that's proposed, how do we figure out what that is, have a dialogue, have a discussion, and then work its way through, a formal public process that everyone can engage in and not have this type of issue occur. Long way of saying that, no, I don't know what the developer's looking to do at this moment. What I can say is we're definitely engaged. We're exploring ways to again, try to address all of the concerns that we've heard here as the developer tries to figure out what he's going to do. How do we figure that out?
And just one last follow-up question for you. You said you reached out to the folks who actually own the property. I don't want to say their name out loud because I get it wrong, but I think people know who it is. Were you able to connect with those property owners in Florida, I assume you advised them of what's going on at their property. Was there any sort of response you can share with the community from there?
I think the property owner, that they have an arrangement with the developer where the property owner's take was it's up to the developer. He has site control at this moment, and so in some respects, the property owner really say it's not my issue, it's the developer's issue. Work with the developer.
Okay, got it. All right. Thank you for that. So let's go back to the county, taking a step back, trying to honor, this idea that we wanted to look at. And I'm hoping with what Oliver's saying that there is some oversight and enforcement of what's happening on Ocean so we can take a step back and go, all right, well, what happens next, especially with the transitional program that was originally proposed to be there. So my questions come back to the county. And the first set was around accountability and preventing, we'll call them future terminated projects. So the termination at Ocean, this came in from the community. The termination at Ocean Avenue the behavioral health projects was explicitly attributed to a lack of transparency and coordination. So the person asked, what specific legislative changes or county policy mechanisms will be implemented to ensure that the county departments like DMH engage in meaningful documented consultation with the local municipal staff and community stakeholders before property acquisitions or projects are announced? And you had mentioned, I think, 16F. So maybe from the county's perspective, how are we improving transparency and communication, all those kinds of things going forward? If someone from the county could touch on that, that'd be great.
I think in Santa Monica, what we know is that there will be engagement not only with municipal representatives from the county, but also the people who are neighbors. And so that is that is entirely what will happen in Santa Monica moving forward. So I've looked over many times the city council's plan, and so I feel like for Santa Monica, that's the plan that we're going to follow moving forward. So we're determining feasibility of another project. If in fact Santa Monica does not want a project for people in Santa Monica, then it's not going to happen, and we'll take the dollars and the project elsewhere.
So if I'm hearing you correctly, it sounds like you'll defer to the city to determine if a project like that would be placed here or not.
Right, because that's it. From my understanding of the city council, I have no idea if that. I don't exactly understand the motion that was passed and how it will be enforced. We will willingly participate in the steps that were outlined. We're not going to go through anything that happened like last time. So any site that we've identified, no, nothing will be signed, nothing will be decided until we've gone through that process. And if the city does not want a behavioral health bridge housing in the city to house the people in Santa Monica, then we won't put that there. To your point though, Matt, there are multiple constituent groups in Santa Monica. So it will be, I think, based on what I've seen from the process up to that, the city council process to determine if the city in and of itself wants to sign off.
Got it. And
So
it's
I'm happy to jump in, Matt. Sorry, just to bring some clarity and ask a follow-up question if you don't mind.
sure, yeah.
Sorry, I just wanted to say that because there was saying some confusion about it, that these projects are not, they're not decided upon by the city. I think we went over that process, right? Like these are decided between the county and whoever has the land and then the program. We're not allowed to opine on whether or not it can be there. Now, I appreciate what you're saying and that you're going to defer to the city based on what happened last time. But what I passed was a few things. One is that we have this open discussion up front so that the community can weigh in. But more importantly, that you guys look at Santa Monica and the fact that we have over 15 service centers and a plethora of different types of permanent supportive housing, transitional housing, access centers within the spa and an 8 square mile city. And at what point do you guys look at other cities within the spa or even collaborate amongst other county supervisors to collaborate within the whole region to say that it can't all be concentrated in one area? Because the reality is we're not serving necessarily Santa Monicans who fell out of rent in their apartment and are now doing meth and mentally unstable on the streets a few months later. What is happening is a large percentage of people are, as we know, come from out of the state. The weather's great, we have beaches, parks, but the reality is people are coming to Santa Monica because of the abundance of services that are provided. So to the extent that we could spread those services across, I think you would see that the weight would be shifted. That's one issue. And then the other issue we can discuss later on is the quality of these programs and whether or not they're actually doing what they say they're supposed to be doing, because it feels like it's just inviting more and more. So I just want to be clear that if you guys are saying that we have the ability to say we don't want this, I just want to say that we've said already to the county, why are you looking in Santa Monica? Like, why does it have to be moved from one address in Santa Monica to another? If you have to stick with the same landlord, then why can't you look at his other properties in another city? Because we're already inundated with so many of these facilities and we're so dense, it's hard to put them somewhere where you're not impacting schools and other residents.
Yeah.
So if I could, and
Um,
if I could just, and Amy, I'm going to answer that question, but many people ask that. There's a perception that Santa Monica maintains more than its proportional share of regional shelters, treatment beds, and that the county keeps placing facilities here rather than equitably distributing them across the spa. Has the county evaluated equitable distribution across all West Side cities? What policies are in place or could be put in place so that all 88 contiguous LA County municipalities, or at least the SPA 5, proportionately is responsible for contributing their fair share of shelter beds? And for people who don't know, SPA 5 goes from Malibu to El Segundo, from our coast all the way out to Beverly Hills and I think parts of Culver City. So it's a large service area. So Amy, do you mind talking about that? Like, is our perception wrong that Santa Monica, disproportionately has more of these services? And is there a process to determine that where there is oversupply and undersupply of these services across your spa?
Yes. So there's a couple things. We're building a heat map right now, which will show you where the facilities are located across the county. And so you can get a sense of there are certainly parts of Los Angeles County that are much more densely populated with services than the city of Santa Monica. But we are going, I think the heat map is incredibly important so people get a better understanding of where we're putting the resources. Santa Monica is one of many cities that have asked that same question. Many of those cities want the services in their city. So they're saying, can you please bring more here? Why aren't you bringing things here? We have people who are homeless here. And so we're looking at how we can really illustrate that for people. So it's very clear where it is. We 1000% would like to build everywhere. We have people who are homeless everywhere. So we absolutely would love to see partnerships and places everywhere in the county. We do, I have to also just say, because we speak to so many residents in Santa Monica, we hear regularly that people want more resources. We will hear vehemently that people do not want something. And we will hear just as strongly the counterpoint that they want these things to come here, that they see a lot of people suffering on the streets in Santa Monica. But the truth is, I just want to make sure we're very clear too, that when we have a program that is run by the county, there is an oversight, a monitoring, and accountability that we can stand by. It is delivering results. 1000%. We have new people falling into homelessness every day in unprecedented numbers that will only get worse next year as a result of the federal administration. But we will continue to run quality programs. We will continue to bring as many people inside as we can. We will continue to leverage every dollar as far as we can because we will have fewer of those. And we are 1000% grateful to Santa Monica for the programs they have here, which is exactly why, when we started talking about a BHBH here, we said, Santa Monica, this should all be for Santa Monica people. We really do look a lot of times at and this is where we have issues because we'll put sites that are county run and think of them as more of a regional solution. So people from different communities go places. Santa Monica made very clear, no, we have a lot of resources here, but we also have a lot of people homeless. So we had very specifically said, we will bring no one then from outside of your jurisdiction. We will only have people that are experiencing homelessness here.
Gotcha.
Sorry, Amy, but just to be clear, when you say it's only for Santa Monica people, I think that's the caveat. It's not, it's not Santa Monica people. We have a train that dumps people every night.
Let me ask that question. I am ready to go on that one. So
okay.
Here we go. We're going down the rabbit hole together. For those who don't know, as I implied, here is SPA 5. This is LA County. Here's us in the teal. As I mentioned, our boundaries go from end of Malibu down to El Segundo, Beverly Hills, edge of Culver City. This is, I'll call it Google's perception. I put in just earlier today, where are the key homeless service access points in SPA 5? And Amy, you can correct me if I'm wrong, but this is what Google believes is to be the truth. St. Joseph Center in Venice. People of Concern, everyone knows about here in Santa Monica. Safe Place for Youth on Lincoln Boulevard in Venice. Now, I am going to show you another map, which is the Metro. And Lana, Amanda Grede, you were just talking about the Metro and distinguishing like who's from Santa Monica and how do folks get here on our streets that we all want to get indoors. But the question is how they get here. And then I'm not super tech savvy, but I overlaid that original map that showed those 3 access points, the key ones in all of SPA 5. So if everyone remembers, that goes all the way from edge of Malibu down to El Segundo, out to Culver City and Beverly Hills. And they are located right at the last stop. If you were going to come to them, you'd go to the last stop of the Metro here in Santa Monica, and these would be relatively walking distance. And so, Amy, this is where people get the perception that maybe there's a lot of unhoused people in our area because they're having to do these access points here. And then it's hard to distinguish, are these actual Santa Monica locals who became unhoused or people who end up in Santa Monica because this is where we put the services? And there were dozens, if not I would say the majority of questions, and Mayor Negrete just raised it, were about this perception. So can you walk us through, is this a misperception that this is part of the problem, that people are coming here to get access and then they're here and then, can you expand on that?
So access centers are 1000% part of the continuum of how we engage with people. Those have been run by LAHSA for many years. I have no idea who funds the access centers that you're elevating there. We could certainly dig into that. I would know more in just a short amount of time to find out. We 1000% agree that we have to spread the services around. So as we are launching the new county department, we will look at the county as a county. We can have more control over where things are put, where they're placed. Where our money has been administered for the last many years has been through LAHSA. So when Supervisor Horvath sat on LAHSA Commission, she made the decision. I don't think we should put our money here anymore. It's not working. We want to have more oversight over these county, hundreds of millions of dollars that we're overseeing. So those dollars are coming back. We will launch our new homeless department on January 1st. So issues like this, Matt, we will have a lot more direct oversight. And when the city of Santa Monica calls and says, why are the only access centers in SPA 5, which I believe you because this is what you've pulled up, then we can say, you're right, let's put them somewhere else. I will also say, Matt, as a comfort or otherwise, access centers will no longer be funded in the new year. So those will all be closing unless they find private funding.
And is there a mechanism when the county recognizes that maybe there is an overabundance or overproportion of access centers, shelters, and things in an area like Santa Monica? A question came in saying is what funding and operational support can the county provide to offset the increased demands that come from all of SPA 5 or really all of LA County potentially to help Santa Monica police, fire, sanitation, emergency services that result from the public safety needs that are being increased to buy these services. So how does the county support the local jurisdictions who are dealing with these things?
So, I mean, there's a couple things. I think we'll see things change a little with Measure A right now. Um, there will be local jurisdictional authority over dollars. So Santa Monica is getting a $1.2 million that they'll make decisions about. And then through La Casa, which is a state agency also funded by the sales tax Measure A, they'll get additional money that will come. I believe it's going to come through the West Side COG, but it's another many, many millions of dollars. So those are investments that'll come from the sales tax. And then, I mean, we are always looking to site more on the West Side. It's a very expensive place where there are also a lot of people who are homeless. So this is the ongoing conversation. Are people homeless there because there's services, because there's the beach, because it's pretty, as many people have said tonight? And so there's this constant dance. So do we provide the services closer to where people are? Do we move them to other parts of the county where there are other people experiencing homelessness? And what I'll also say is typically when we're thinking, I mean, from my understanding, and when is that like voucher programs and different housing programs can require, Santa Monica has made a decision to require that you prove that you've lived there for 5 years, for example. For something like a shelter, typically the way we say someone is from Santa Monica, yes. I mean, if it's an outreach team has been engaging with them, some are funded by the city specifically, many funded by the county. And we see people that have lived, many people, we hear from constituents that they've known people on the boardwalk for years. And those are the people that we would say that are saying, this is where I've lived for X number of years. I've slept here, and we want to get them involved in services. Yeah, it's very unlikely that they'll find a housing in there, but if we can get them inside, connect them with services, then we'd like to do that. And so that's why we try to find places all over the county so they're kind of close to where people are experiencing homelessness.
Gotcha. I appreciate that. Mayor Negrete, I apologize. I had interrupted you. I got so excited because I had made these slides and we were right about to get to the topic. I want to let you continue your point that you were trying to make. I apologize for
No, it's okay. I just, one thing I want to address is the rule is actually now 1 year. You have to prove that you're homeless in Santa Monica for 1 year. And again, I just want to reiterate that what that means is you've been in the system. You've either called 911, you've been arrested. I mean, that's really the only way to identify someone outside of the fact that they had an ID and traced back to a residence in Santa Monica. But I do want to point out that I want to back up on two things. So one, before I get to the original point, is something else that the county funds is the needle and harm reduction program, where they come into our parks and offer smoke kits and needle kits. And I worked diligently with Dr. Barbara Ferreira and Dr. Sai last year and made an agreement in the city manager's office that they reduce the times that they come based on, because they really didn't have a benchmark as to what made them decide what park. And so they said, fine, we won't come in if there's less than 5 people. What is interesting to me is we're talking right now about mental health and substance use and homelessness, and all of those things obviously relate. And yet we're still operating and funding a program that literally is putting paraphernalia in the hands of people. And I would beg to differ that people are not dying from hepatitis. They're dying from overdose and from being on the streets. And so our neighbors are finding that, when you hand the needle or the smoke kit, they don't go in an alley to do the drugs. They do them right there and then they leave the needle behind. I know that the federal government is potentially cutting programs that fund those, but to the extent that that doesn't happen for another couple years, what is the county going to do about the harm reduction program? Because it is feeding into this constant issue of all the things that are happening that are impacting the well-being of our entire community.
So I have been party to a few phone calls where the city has said we don't want there to be harm reduction. I've seen a couple of the reports that have come where there's been a small bit of engagement at a couple parks. I'd have to come back to you, Mayor, and I'm so sorry. I should have checked on that before I got on the call today. Exactly. My last understanding was that the programs were moving from the existing parks, but I could be totally wrong. So I'd love to follow up with this group and we'll send that out.
Yeah, and I appreciate that, Amy. And I don't mean to be harsh, but I just got to say that, like, these are things that I think are frustrating. Like, we can't get an answer as to when they're in the park, how often they're in the park. And so, and the needles and the smoke kits aren't labeled that they're coming from the county. So when we find them crushed or in the street and we have to pay for extra services or extra gear for our city folks to wear special gloves so they don't, hurt themselves picking up sharps in a bag, like, we don't have anyone to go to because we don't know for sure that it's from the county, but we can only guess. My original question was just talking about the jurisdiction as you guys look to continue to work with the same landlord or the same developer or whatever. I know you guys are looking at sites in Santa Monica, and you mentioned before, and I just want to make abundantly clear, because if you're saying right here and right now, I could tell you that we feel like we have a lot of these things and we need to take a pause and assess the programs we have now. So, I mean, are you saying right now that if you guys land on a site at some address, you're going to come to the city and we're going to do a public engagement? And if you catch on that, hey, nobody wants this thing here, which I can't imagine that anyone's going to be like, oh yeah, that's a great area. Then you guys are going to say, okay, we're moving on outside of Santa Monica? Or are you saying that even in this conversation, if we were to say, we feel, given the experience with this particular developer, we don't trust anything that's going on there, and we would prefer that you guys look outside the city of Santa Monica, that you would take that note from this meeting?
I will. I've already taken. I mean, I will take the note about that there is incredible concern that you, in fact, you are representing the voice saying we do not want behavioral health bridge housing in Santa Monica. We are assessing places outside of the city of Santa Monica. So, and again, maybe I'm
Yeah, and
maybe
I
I
just
don't
want to
understand.
correct you. I'm not saying we don't want behavioral health bridge housing, because I don't want to be coined as saying that I'm anti solving a problem. I think what we're
Oh, I'm
saying is,
sorry. I thought that's what you
yeah,
said.
we haven't seen it. To the extent that you're moving it from 413 and 825 to another location in Santa Monica, I'm saying we have a lot of access centers right now that we're trying to figure out what they're doing, how effective they are, right?
Mhm.
And so we're saying, can we please at this point take a pause on choosing Santa Monica as a location, since you have this developer who clearly owns buildings in other cities? Or do you even have to continue to work with him and not be locked into only having to work with this guy who's giving you the buildings that he has? I'm hoping that you guys would be willing to consider even a financial loss if you have to work with someone else, because as you can see, he hasn't made the effort to be a good neighbor. And more importantly, I think there's a three-legged stool that needs to be talked about, which is the elephant in the room. That, although, like you said earlier, you're dealing with the developer, not the operator. And so St. Joseph's might be amazing, and some of these other program operators might be great people. And this is a difficult population to work with. I get that. However, to the extent that somebody is utilizing a vulnerable population to temporarily provide them a space with no plan on when they entitle their luxury project, that is essentially the main goal, where those people go, it's a problem. They're utilizing tax dollars, whether it be through behavioral health housing in the county or private insurance dollars. They're impacting the well-being and the infrastructure of the community. They're utilizing police and 911 services and all the things that go with that. They're impacting the community. I mean, we're sitting here, we've spent copious amounts of hours researching and getting on phone calls and talking to the community. And so to the extent that these people are doing it, and at the end of the day, when they finally get their entitlements, what's the process for these people then? Because I can tell you, we've seen it, and they end up on our streets. And I can also tell you that to the extent that you guys are saying, well, we kind of just deal with the operators, we have seen even in the behavioral health, like at the Manor on Pico, folks being out lingering within the community on the streets because we know that we don't have locked facilities. We don't have hospitals, which is really what these people need to have true detox and have a touch point with a psychiatric care team every day. And so that to us is the point. Like, I hear you, you guys are limited. Not everybody's offering up their building. And I get that the state made laws so that people couldn't say, no, 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 not in our city. But now it's had unintended consequences because unfortunately, a lot of these places are unchecked. They're not doing a great job. I know you guys have to say, like, hey, we're helping people, but how do you know? I mean, we've seen time and time again that the same people are being housed. We hear about it takes $1 million to get someone an apartment and then they move out. And we've heard reports of it took us 3 times to house this person. So I think people are just frustrated and they want to hear the county say, yes, we do care if we're working with an operator who's breaking the law and getting fined by the city, and we don't want to do business with them. And it's unfortunate. And we're going to regulate these programs and we're going to get down to brass tacks and give you monthly reports if we have to understand who is coming in and out of these places. Because at the end of the day, it's failing the very people we're supposed to serve. And it's also failing the entire community. And then it becomes this unfair political thing of sort of, pinning neighbors against each other and things. So I think that's just the essence here. Where there's obviously an articulate, smart, respectful group here that's asking very poignant questions. And I hear that there's a separation, but that's the problem in government. People want real people answers. They want you to know that, hey, we live in these communities, and whether we walk out our door and see these people, or our kids are stumbling over them on the way to school, or just on my way home, I had a guy sitting in the middle of the road and stopped traffic for 15 minutes, which was partly why I was late getting on this call. So we are seeing it every single day in our city. And we are one of the largest. If you look at AI and you just ask where are the most access centers in SPA 5, it's Santa Monica and Venice. It really is. And they're not Santa Monica homeless. I think people are frustrated about that because what does that even mean? We are a service center for the whole entire county. And it's time that the county take a look and say, this is not fair. It's costing taxpayers money. And guess what? Our employees are not getting the raises they deserve often because we're funneling so much funding to create new ways to address the people on the street. So if you guys could provide us, and you're telling me right here on this call, hey, we get it. You guys are saturated. We're going to look elsewhere. We would like to hear that commitment right here and now, because I don't think we need to have another committee meeting about whether or not the next site is the one that needs to go. We can tell you right now, we've got enough. As a matter of fact, we have so many beds. We're paying the people concerned, of which the Department of Mental Health and the county works with. We are paying them for beds, and they are selling beds to Malibu. That's double dipping. So, I mean, at this point, if Malibu is buying 7 beds and we're paying for however many beds here, like, how is that fair to us? We're now supplying beds for Malibu. So we would love your help at the county, because the reality is you're above us. When the constituents come to me mad about needles in the park, or mad about what's going on, I have to point and say, I can't do anything, but I'm on the front line taking the bullets from the community over things I can't control. So I appreciate you coming on here today. And I really hope you hear us today, that it's not that we don't want to help folks on the streets. We want them to actually get help. And at this rate, it's impossible to see that anyone's even getting any help, because we're just churning people in. Every single day, we've got 40 people getting dumped off the train at night with nowhere to go. And I would love to hear if you guys know what's happening at the Manor, by the way. It's been shut down, and I would love to know where the remaining 39 people are set to go, number one. And number two, when you work with these people who are eventually going to entitle a project, do you have a system to relocate those people so they don't just end up out on our streets?
There's a couple things. One, if we have a county operated program and it's closing, we are going to move every single person. We always have. When we close a PRK, we close a Project Home Key, a shelter closes, whatever happens, everyone gets moved. The Manor is not, first of all, there's behavioral health bridge housing is a new funding stream. So that doesn't exist. It's a program that hasn't existed until now. It's funded by the state. It was funded through Prop 1. So the Manor is not the same model. It's important to say that. We bought beds at the Manor from an individual who owned the Manor. And for many years, we had many conversations with him to say, we don't want to buy beds here anymore, but we didn't have other beds for people that had mental health services that we could get at the manor. So I want to let Dr. Funk speak a little bit as someone from mental health who has worked with the manor for many years. If you can answer the question, Dr. Funk, if you know anything about the people who've been living there, who've left. And then I think we should let Dr. Hurley speak. It occurred to me, I forgot that he was here. Mayor, Dr. Hurley can speak to the harm reduction program.
Yeah, hi everyone. Maria Funk, Department of Mental Health. So regarding the manor, you said it was closed. So I actually am not aware that it is closed. So I do know that the
It's
county.
closing. Sorry, it was supposed to be closed in August, and we've been hearing it's closing and slowly. I don't know if they're moving people out.
Okay. So I do know that, as Amy said, that another department in the county had bought beds there for interim housing, and that is closing. So that I know, but I'm not clear about the manor closing entirely. So I'll have to look into that. I had not heard that. We do have clients at the manor. People, that is a licensed residential care facility. We talked earlier about some types of housing do require a license by the state, and that is one of those. The state is the one that monitors it and makes sure that they're in compliance. We do have clients from the Department of Mental Health that are living at the manor, but I don't believe that we've been told that it's closing. So if it is, as the question that came up earlier, we will work to move all of our clients to another licensed facility. That is required when licensed facilities close because they do serve a very vulnerable population. So we will.
Oliver, sorry, our city manager can confirm. I might be being misquoted. They originally said it was closing, but it might be some portion of it is closing. Nonetheless, I guess my question is because we see people lingering and loitering around outside of these properties, I'm just curious, like what happens to these people? And you just answered that question. So you're telling me that 100% everybody gets moved to another facility. They're not just ever left without a place to go.
That's absolutely, that's required by licensing, and they monitor that. The state licensing, Department of Social Services, they monitor whenever a licensed facility closes that every single person is moved to usually another licensed facility, or sometimes they go home and live with family.
I do want to be able to pivot back to say, but Dr. Hurley, I'm going to ask you to give your half-day seminar in maybe a minute or two about harm reduction, if you could. I do think
Sure.
people have a misunderstanding of what harm reduction is. I know there's been questions, are there glass pipes in the harm reduction kits? So maybe the high-level important stuff that people could understand about what's happening in Santa Monica with harm reduction, if you would be so
Sure.
obliged.
So the county supports a harm reduction, a set of harm reduction contractors that serve the community. One of them operates in Venice and in the Santa Monica community. The locations that are currently certified by that vendor are Tongva Park, Palisades Park, and they only go into the park if there's people in the park that are there. They distribute naloxone. They distribute syringes. They distribute smoking equipment. And the rationale is that people that use drugs are generally going to use them anyway. So having access to syringes doesn't make people use drugs. Having access to smoking equipment does not make people smoke. But the public health rationale is that access to syringes, access to smoking equipment decreases the risk of the spread of infectious disease. These operate for less than an hour a week, right? So they are it's a relatively small amount of time, and is a important public health measure in order to help prevent people from dying, in order to help prevent the spread of infectious disease. Oftentimes there's the perception that if you provide harm reduction supplies, that is why people are using drugs, right? And again, when people don't have access to supplies, they usually find other ways of using them. They share needles. It doesn't necessarily prevent the use of substances. But again, about an hour a week harm reduction program that we operate also then collects any used supplies when they're out there. Now, the fact that they're only there for an hour a week means that there's always the possibility that there's supplies that aren't collected because again, it's an hour a week. And we've heard extensively for many years from the city of Santa Monica concerns that the harm reduction program is sort of like the cause of people exposed to homelessness, the cause of people using substances. But at this point, we don't go into any of the locations, either of the parks, when there aren't people there, right? What triggers harm reduction service is that there are people in the park that need to be served.
Dr. Hurley, can I just clarify for the community, because I've gone out to witness what this is myself, because I wanted to learn before I had those conversations a couple years ago. Can you explain to everybody what a smoke kit is? And if you could also explain to me, because I still don't understand, like the needle, I get the blood and all that, but I don't understand where the glass pipe, I'm confused about how you
Yeah, so
stop the spread of disease there.
I'm happy to. There's actually a fair amount of literature around the public health benefits of smoking equipment. But when people have access to smoking equipment, they inject less. So the idea is it actually is a way of diverting away from injection drug use in the first place, and that then reduces the risk of infectious disease. You overdose less if you smoke versus if you inject. So those are those would be the public health benefits. But happy to share more information around
Yeah.
the
And
again, public health benefit.
are there other tools? Because I remember being told by Dr. Barbara Ferrer that this is just one of the tools in the toolbox. And I made the comment that at what point do we figure out that we are banging a nail in with instead of a hammer, we're using a screwdriver? And I'm just curious, like you said two parks, but you guys are also in Reed Park, which is
yes, Reed Park. Sorry,
Yeah.
that's right. I had misremembered the board. Yeah, you're right. We're also at Reed Park. Thank you.
Reed Park right across the street from a church and a school and a preschool. So that's one of the most contentious parks. But just curious if you guys are gonna think about putting that tool back in the toolbox anytime soon.
So the range of services that we offer to address substance use in the community is a lot of psychoeducation information around substance use prevention. We partner with a lot of schools and other community-based organizations in order to get the word out around substances that people are at risk of using and highlighting alternative substance use. So that's a big part of our portfolio. We do have a number of harm reduction partners that go out and provide, again, harm reduction services. We also contract with treatment providers. The treatment provider that's closest to Santa Monica, Claire Matrix, has a set of residential and non-residential services, and recovery bridge housing. It's a small supply of interim housing. We don't currently operate any recovery bridge housing in the city of Santa Monica, but at other locations in Los Angeles. So we have a portfolio of substance use prevention, harm reduction, treatment, and recovery services. And we see them all as a way of engaging people who use substances because we want to get people as soon as they can into treatment, into recovery. But we also recognize that harm reduction services accept the reality that some people aren't ready to do that. And harm reduction services can be a key point of engagement.
And I understand that. I just wanted to leave you with this thought, just as a parent. And are you a parent, sir, Mr. Dr. Hurley?
I am not a parent.
Okay. Well, I would just say as a parent, if I walked in the room and saw my kids doing drugs, I definitely wouldn't provide them with clean paraphernalia. I would be putting them in a space to get help. And I think that's kind of how we see all of our patrons on the streets, right? As somebody's child. And I just want to leave you with that thought, if you guys are reconsidering how you look at harm reduction.
And I appreciate that. And I promise to the audience, if Dr. Hurley is willing to come back, Mayor Negrete, we will invite him back and maybe do more on this topic. Dr. Hurley, I know people are asking in the chat for research. If you'd be willing to share pamphlets, your research with NOMA, we could publish it on our website. I have heard the concerns are really the locations, as the mayor identified, Reed Park, kids play there, all the other parks. Also, the mayor in her previous comments was talking about there's often drug paraphernalia left behind. So I don't know if that's something the county can look into as far as making sure once the teams have left and the kits have been given out, that maybe there's a better sweeping system to make sure that there's not unintended consequences left behind in the community. And are these locations the best locations with our families nearby?
Sure, absolutely. Thank you.
Okay, thanks. And I will pass those on to everyone. So I want to pivot. I know we had said 8:30. I have 3 questions left that were really high interest from the community. So I want to get to those from the city perspective. So I'm going to put Oliver back on the hot seat. This warm seat. friendly seat, whatever seat we want to call it. But Oliver, this question will go to you. And I think this is especially relevant. I want to, before I ask the question to Oliver, say to Mayor Negrete, I saw all the applause, the hands raised. The sentiment from this group is just gratefulness. All you did over the Thanksgiving holiday, in the statements you just made, representing our community to the county and the things that you're asking for and representing. And so that's why I'm pivoting to this question. And Oliver, this came in, there were dozens, and I tried to formulate this in a way that would be the most constructive. So I'm going to just read it. The incoming mayor is employed by Los Angeles County as a policy director overseeing policy efforts in economic opportunity and human services. Because Council Member Terosis's job at the county may sometimes put the county policies and goals she's trying to achieve into conflict with the process, preferences, and goals of Santa Monica. As an example, Oliver, and this came in from the comments, I wasn't at the meeting, you spoke at the Friends of Sunset Park meeting on Tuesday that the city needs to have a discussion about what our appropriate share of homelessness response and services should be, particularly given Santa Monica's other goals of a clean and safe city that's attracted to visitors and tourists. And that's crucial for our long-term financial health. So the question is, and the other context is the mayor speaking on our behalf just right now. What is the process for how to handle these inevitable conflicts when a mayor's county job may at times directly conflict with her fiduciary responsibility as an elected city council member?
Oh. Matt, you made the seat really hot.
Sorry, but many
no.
people asked.
It's certainly a question I think we're happy to answer. The reality, I think, is this: all of our council members have different professional pursuits. Being on the council is a part-time job, so we understand that. Anytime there's an ethical conflict or a legal conflict, the city attorney and I, we sit down, you sort of address it with the individual council member. And if there is, sort of a legal conflict, that council member has to recuse themselves, and we'll notify them of that fact. If there is an illegal conflict, it's a policy preference, and ultimately it's up to each member of our council, including our next mayor, to make the decision: are they going to engage in that particular vote? And ultimately, the community gets to decide what they think of that. If a decision's made that runs contrary to what the public wants, that's why we have elections, and folks get to voice their opinion that way. But I want to be really clear. We absolutely make sure if there are any ethical conflicts or legal conflicts that we identify, we sit down with the council member, identify what those are. If it's a legal conflict, there's no question. We'll advise and let folks know you're not allowed to participate in a particular decision. If it's a policy decision or policy preference, that issue then is up to the council to make the decision. Are they going to participate and how they're going to engage?
Understood. I appreciate that. I think accountability, the second of the three questions, is really around accountability when we're going back to these Ocean Avenue properties. And many people asked about an updated timeline. I think the timeline had been put out maybe a month ago of kind of how this all unfolded, when staff and city council members and everyone knew. Is there any sort of updated timeline you could share? I know there's members of the community who are seeking documents being released, and I'm not sure what the process is for them doing that, but many people kind of asked, do we have a better understanding and accountability of who knew what and when?
And I assume, are we referring to the original BHBH project that was proposed?
If that's the one for the transitional housing?
Yeah. Transitional housing, sure.
Yeah.
So the way the timeline on that worked, I think in late March of 2025, we had conversations at the staff level with the county, or the county staff reached out to inform the city that they were looking at a potential project. I know the city staff at that point requested that the county reserve some of the beds, if there was a project, for Santa Monica's use that we could refer into directly. Then in April of this year is when, again, there's lots of ideas that are floated. At that point in time, I don't know that it was a real project. But then in April of this year, a land use attorney did contact the planning department, identified that they were going to pursue a project and they needed to get permits to move forward with the project. We, through April, identified the project was happening, and I think that's when, okay, this appears to be real. They're looking for building permits. That's when we started notification processes internally. In June is when the project really started to go live. In June, the developer, his attorneys met with the city's team and really identified that they were moving forward quickly now to get all of the approvals from the county. They've had those secured, and we're going to, as soon as they receive funding from the county, move forward with advancing the project. In August and September, as the project continued to unfold, as the county and the developer finalized all of the various agreements they had in place, and as they continued to seek building permits from the city, additional notifications were made to the council. And as we moved forward, we were told the project was going to open initially in September or October. Ultimately, that didn't happen, and Mayor Negretti put forward an item. Moving forward, we now have a new protocol. When there are projects that are formally proposed, there's a new public notification and assessment process that will engage. So that's a quick overview of the timeline as we understand it.
Okay, got it. And then one last question, and then actually, Mayor Negrete, I promised that I would get to your item that's going to be on Tuesday's council meeting, so I do want to do that. But last question to you, Oliver, is many people asked about, is there a registry of sober living, transitional housing, shelters, et cetera, in the city of Santa Monica? I think I heard the county was developing one, if I understood correctly. Or one could there be one developed to increase the transparency and understanding of how many beds Santa Monica already has? Does that exist, or is that something that's being worked on?
Yeah, no, it's absolutely being worked on. And I think, all of the conversations we're having here, I think really relates back to something that I know the council, the staff, we've all identified. There's this overwhelming sense of disorder, I think, that we've seen in Santa Monica, and that's impacting everything. It's impacting how folks feel when they're going to a park. It's impacting private investment into all of our business and commercial corridors. It's impacting tourism in the city. There is a narrative, right, that's happening internationally that Santa Monica is not the place it used to be. And we have an international profile. I mean, against that backdrop, I still think Santa Monica is it's one of the coolest places on the planet. And as a city, we have an obligation to make sure that we're addressing public safety related concerns to tamp down the disorder while also continuing to move forward and making sure that the services we offer, we have a very rich, diverse set of services. We should all be tremendously proud of what we try to do to help people here in our community. We have to make sure those services are aligned. And so one of the things that we have been doing recently as part of the realignment plan, we're mapping out what are all of the existing services that exist in town. How do we link our interests in how those services are offered? And our interests really are Santa Monica residents. How do we make sure that you shelter those folks and get them into actual housing in a way that's logical and thoughtful? How do we, concurrent to that, remove the issues that are creating an attractant for disorder, so that we can help those that truly need help that are here, and make sure that the services we're deploying are actually useful. A long-winded way of saying that, we're working on that. Actually, Allison, the city manager's office, our team, we're mapping out right now. And Allison, we're so blessed to have her on our team. Allison used to work at LASA, has a tremendous understanding of how LA County related systems work. As what we're working on right now, really, and we think we can help create a model. How do we think through the issues that currently exist in the homeless services world? There are issues, certainly. I think that it's all well-intentioned, but a lot of money, a lot of well-intention, a lot of opinions, a lot of need. That's all created, a system that I think folks are frustrated with because the situation isn't getting better. In Santa Monica, we have big city problems, but everything is manageable where we can actually effectuate an outcome, we think. And so the work we're doing right now is, one, certainly there's issues with, what's happening with the train. There's issues with how we deploy public safety. There's issues with the Access Center and Sam Shell, our existing sheltering facilities. How do we address those issues to make them not serve as an attractant and instead replace those things with new systems? How do we find the proper sheltering and link those sheltering units we have to actual housing so that we can take care of our residents, make the city feel much more orderly, much safer? Those are things that we're working on. And so in the next couple of months, part of the larger plan to realign how we operate that the council recently approved, part of that plan right now is really mapping out all of the units, shelter, transitional housing, permanent supportive housing, sobering facilities, all of those operations that exist in town. So there's a lot of stuff that exists in town that's funded through various sources, private sources, county sources, state funding. Not all of it runs through the city, and we don't actually have a good understanding of how that all interacts in our city. We're mapping all of that out as we implement the safe and clean protocols in the plan. So in the next couple of months, I'd say within the next 60 to 90 days, we'll be ready to identify, here's what we think about all of these issues. Here's the new system that we want to implement to try to link everything together.
That's great. And I think everyone supports that effort for a clean and safer Santa Monica. I think the only feedback will probably be you couldn't do it fast enough. So we really appreciate the work on that, to say the least. I want to give you, Mayor Negrete, maybe the last word. I know everyone's tired, got kids to put to bed and all of that, but you had mentioned in our communications that you're going to introduce a 16 item at this upcoming meeting, which for those who don't know is actually Mayor Negrete's last serving as mayor. So Tuesday night, we all need to give thanks to her service over this last year. But I wanted you, if you could, just high level overview that it sounds like it's designed to create stronger guardrails, earlier notification of in reaction to what happened over the Thanksgiving holiday on Ocean. Do you mind just kind of giving the community a little tidbit of what you're proposing on Tuesday, if that's still in play?
Yeah, absolutely. I first of all just want to say, Matt, you should be doing like professional interviews. You are amazing. I don't know. This was like a 60 minutes. I was like, oh my God, everything from the cadence, your voice, the questions. I just really appreciate how professionally ran this was. And I just want to say a big thank you to you and to all the community members who submitted questions. And I also want people to know that I'm still going to be a council member and I'm still going to be in the community. I know some of you have just kind of gotten to know me because of this thing, but I have been in the community and doing these things, and I'm going to continue to do updates. And you're going to have to look at my stupid Instagrams and my newsletters. So I'm not going anywhere. I just have a different title. So instead of mocha with the mayor, it'll be cocktails and coffee with the councilwoman. So the 16 item I'm going to direct is much like the behavioral health one and creating transparency. There is that piece of it. But because this congregate style living, residential occupancy regulations kind of are different, and recovery housing, sober living. I wanted to create something specific to that. So I'm going to be directing, and I hope that the council will support the city manager to return to council, hopefully sooner than later. I know we put 90 days in there, Oliver, but I'm hoping I know we got the holidays, we can do it quickly. Land use clarification and classification. So really establishing clear definitions on land use for sober living, recovery housing, congregate living facilities, and other uses, and distinguish them from other ordinary types of residential occupancy, local registration, and operator ownership disclosure. As you can see with sober livings, I'm not saying that this is what this place was doing, but body brokering is something I've been very familiar with. And a lot of times when they use so many LLCs, you can't track if there was nefarious behavior because there's all these shell LLCs. So requiring registration of sober living and recovery facilities and mandating them to disclose the operators and the beneficial owners, LLCs, property managers, and anyone who's controlling the entity. Licensing exemption and documentation requiring operators to provide state or county licensing, safety, occupancy, and operational standards, just establishing an objective of standards related to maximum occupancy, the room configuration, so we don't see body stacking, which is another activity that happens there, emergency protocols, house manager requirements, good neighbor policies, and so on and so forth. Inspection and access and informant tools requiring us to be able to go in there and inspect just to strengthen our enforcement consequences when operators deny access, like what happened this last week. So for denied access, having that come with some consequences. If anyone violates occupancy rules, that they'll be met with consequences to match that. Continuity of care and relocation planning, meaning that, if this thing is just a temporary place, we want to make sure that there's a plan when the sober living or recovery facility building closes. You'll hear lots of times in these places, I'm not talking about the behavioral health now where it's highly regulated with the county. I'm talking about these unregulated sober livings where people just, their insurance is canceled and they're kicked out on the street, or the building is now no longer sober living. What happens to all those people? So requiring them to have a plan for relocating folks. Interdepartmental review protocol. Creating a proactive early identification protocol across all city operations, the city manager, the police department, fire, housing and human, building and safety, code enforcement, and the city attorney's office. And then, of course, requiring community notification and transparency, evaluating really early communication to the community and of these registered sober living facilities of a certain size and intensity, and then legal review and making sure that all proposed regulations comply, of course, with state housing and ADA and all those things. So I'm asking for them to come back hopefully sooner than later, because we know that this particular landlord is putting, and I just want to make a note to folks. I think what is happening here is, like, this is a person who has a building that wants to develop it into something that will make him money. And right now, he is sort of like the lessee. And in order to get a return on his investment quickly, he has to lease it out in the most easy fashion possible. So he's choosing housing types that come with either money up front, like behavioral health housing, or easy, reliable money from sober living that is less prohibitive, meaning that the city can't get involved and block it and require a lot of things beforehand. So that is why he's choosing these types of facilities to move in there. And unfortunately, the city of Santa Monica and this community has been caught in the middle of this person owning multiple properties there. So I hope that some of these things will put a safeguard. We have one for the behavioral housing and making sure we have early communication. And now, hopefully, if this passes on December 9th, we'll have something in place as it pertains to sober living. And with that, I just want to say thank you to everybody. I have to say that when I got the call, when I found out through the newsletter from our internal newsletter from the city manager about the original project, I immediately texted Lindsay Horvath, and she said she wasn't aware of it, and Constance, her team, and they worked on their end at the county. And it was because, once I got notified, everybody was like, what's going on here? But also this situation, if Matt had not called me on Wednesday and Vicki Goodman had not texted me, this whole thing they might have been there for a few days. So I would just want to say thank you, because it really does take a village and the whole community together to step up. You guys reached out to me. The only thing I will say is I think we need to have a good process so that if it is a holiday, God forbid I was, somewhere else, that we have a real clear way for our residents to be able to contact people when they see something happening within their community like this. So thank you guys for showing up. Thank you for contacting me, and thank you to the city staff for responding. Thank you to the county and the state for showing up and taking all the tough questions. I really look forward to collaborating and coming to some common sense resolutions around how we deal with this population of people, because right now I think it's impacting everybody's life, those on the streets and those that are living in the city. So thank you guys for coming tonight. I appreciate it.
I appreciate all that. I'm very hopeful that your 16 item will pass unanimously. It sounds like it is very applicable and would be very helpful. Just a couple of parting thoughts. I want to thank everyone from the county and the state and the city for coming. I know we were short on time, and you all are super busy and have huge areas to take care of. I'm hopeful for the county and state, hearing kind of how much this community and these vulnerable populations have struggled, and hearing the mayor talk about how the city has, by right, has to approve some of these things, that there can be solutions at the county and state level that will really be able to help in the future. And I want to thank everyone for coming and participating and submitting all the questions. I wouldn't have been able to ask them if it hadn't been for all of you. We'll be back to regular program, I anticipate, in January. Bruce will be back leading on many topics as promised. If there are things of interest, I saw Bergamot was hot in the chat. Email us, let us know, join NOMA, come to future meetings. I'm hopeful that we will be able to dig deeper on these topics and many other things affecting the city. The civic auditorium is something that's very important to NOMA. So those will be future meetings, and I hope everyone has a Happy holidays and a great new year. And thanks again for everyone who participated and came tonight.